If you're dealing with joint pain, tendon injuries, or degenerative arthritis, and you've been told your only options are painkillers or surgery, there's another pass. Hi, I'm Dr. Gez Agolli, and in this video, we're talking about regenerative orthopedic injections, advanced minimally invasive therapies designed to help your body repair, rebuild damaged tissues naturally. This approach is part of a growing field called regenerative medicine, and it's revolutionizing how we treat orthopedic conditions from chronic knee pain, shoulder injuries, back issues, and osteoarthritis. What are regenerative injections? Unlike traditional orthopedic treatments that focus on managing pain or reducing inflammation temporarily, regenerative therapies are designed to stimulate actual tissue healing at the cellular level. These therapies include PRP, which is known as platelet-rich plasma, stem cell, or better known as mesenchymal stem cell, peptide, and growth factor injections. Each of these work by activating the body's own healing mechanisms, promoting tissue repair at the site of the damage, whether it's cartilage, ligament, tendons, or joints. So let's start with PRP. Platelet-rich plasma is one of the most widely used regenerative injections. It involves drawing a small amount of sample of your blood, spinning it down in a centrifuge, and isolating the platelet-rich portion. Very rich in growth factors, natural healing signals that your body uses to initiate tissue repair. When injected into an injured or inflamed area, like a torn meniscus or arthritic knee, PRP can help reduce pain, stimulate healing, and support long-term recovery. It's been used by elite athletes for years, but it's now accessible to anybody looking for more natural orthopedic solution. What about stem cell therapy? Stem cell therapy, more accurately called mesenchymal stem cell therapy, uses screen donor placenta from an FDA-approved laboratory to regenerate damaged structures. These cells are multipotent, meaning they can differentiate into cartilage, muscle, tendon, or ligament tissue depending on where they're placed. They also release anti-inflammatory and healing factors that can enhance the local environment of the joint or tissue being treated. This therapy is especially promising for advanced joint degeneration, rotator cuff injuries, tendon tears, post-surgical recovery, and even early-stage joint replacement avoidance. When applied early and strategically, stem cells may delay or even prevent the need for orthopedic surgery. Peptides and growth factor injections. Peptides are short-chain or amino acids that act like messengers in the body. Certain peptides and synthetic growth factors can support collagen production, reduce inflammation, and enhance cellular repair, especially when used in conjunction with PRP or stem cell therapy. In an integrative model, these are often customized based on a patient's biology. And the goals, for example, are peptides like BPC-157 or GKUCU are both peptides known for regenerative properties. Why regenerative medicine makes sense? Your body already knows how to heal. It just needs the right support at the right time. Chronic inflammation, poor circulation, or repeated injury can interrupt that healing cycle. Regenerative injections reactivate that process at the cellular level. This is particularly important in areas like your knees, shoulders, hips, spine, elbow, wrists, ankles, and feet. In many cases, these therapies offer patients relief without surgery and allow for improved function, mobility, and most importantly, quality of life, especially when paired with physical therapy, nutrition, and other supportive treatments. Is this right for you? Regenerative orthopedic injections are ideal for active individuals who want to avoid surgery, patients with mild to moderate degenerative joint issues, chronic tendonitis or ligament injuries, post-surgical recovery, or failed surgery cases, and anyone looking to address pain at the root level, not just masking it. These therapies are safe, well-tolerated, and customized to each individual's condition and your goal. They work with your body, not against it. If this video helped you learn more about the future of orthopedic care, be sure to like the video, drop a comment below with your questions or experiences, and subscribe to our channel for more functional and regenerative medicine insights. And don't forget to hit the notification bell so you never miss an update. And more importantly, this is your life. Live it well.